You ever been to the doctor's office and you notice they're spending more time staring at their screen than actually looking at you? Yeah, it's a huge problem, and it's especially tough in pediatrics. So today, we're going to dive into this really fascinating piece of AI called ExamNote AI. It's designed to fix that exact problem and bring the focus back to what really matters, the patient.
All right, so to really get how powerful this is, we're going to break it down. First, we'll tackle what we're calling the pediatric puzzle. You'll see why it's such a unique challenge. Then, we'll look at the keyboard barrier, which is basically how technology often makes things worse. After that, we'll introduce ExamNote AI itself and see how the magic happens. And, of course, we have to talk about trust and security before we get to the most important part, what this all means for actual patient care. Okay, so imagine you're trying to solve a puzzle, but the pieces are constantly changing shape and maybe even crying a little. That's kind of what being a pediatrician is like every single day. The challenges are just so unique. And you know what? The standard tools just aren't built for it.
So you might be thinking, a kid's checkup? Isn't that just a mini version of an adult's? Oh, no way. It is a completely different world. That exam room is a whirlwind of information. You've got multiple people talking at once, a patient who can't always tell you what's wrong, and a doctor trying to capture every last detail. It's a recipe for total information overload.
And this really breaks down why it's so tough. I mean, first off, you have these three-way conversations happening all at once. Doctor, parent, and child all chiming in. Then you're trying to track these incredibly rapid developmental milestones that are changing constantly. On top of that, you've got this whole layer of complex billing codes. And let's be real, exams with kids are completely unpredictable. You can't stick to a rigid script. So you've got all these unique pediatric challenges, right? And then you try to force them into this rigid, one-size-fits-all software system. And what do you get? You get what we call the keyboard barrier. It's that moment where the tech that's supposed to help actually ends up getting in the way of the human connection.
The administrative burden. Man, that phrase just perfectly captures the soul-crushing reality for so many doctors. Get this. For every single hour a doctor spends with a patient, they can spend up to 2 hours on paperwork and admin tasks, 2 hours of clicking, typing, and navigating menus instead of actually focusing on a person. It's wild.
Imagine trying to have a natural, flowing conversation with someone, but you have to stop and fill out a form after every single sentence they say. That's pretty much what it's like for pediatricians using these standard medical record systems. They're forced to bend to the software instead of the software adapting to them. It's the classic case of the tail wagging the dog. So we have this really clear problem, right? Rigid software just doesn't work in the dynamic world of pediatrics. But what if we could flip that script? What if we could build a tool that's actually designed to adapt to the doctor and not the other way around? Well, that's exactly where ExamNote AI comes in. And let's be clear, this isn't just another digital scribe. ExamNote AI is a purpose-built tool. It was designed from the ground up to handle the unique, beautiful chaos of a pediatrician's office. It's kind of like having a super-powered assistant who can perfectly understand the nuances of that three-way conversation between a doctor, a worried parent, and a little kid. So what is the secret sauce here? Well, ExamNote AI is this AI-powered scribe that just listens to the conversation in the room. And then, like the world's best assistant, it automatically generates 3 critical things: the official medical notes for the chart, the correct billing code so the clinic gets paid, and my personal favorite, a summary that parents can actually understand. Okay, I know it sounds almost too good to be true, doesn't it? An AI that can understand the chaos of a pediatric exam and just turn it into perfectly structured notes. So let's pull back the curtain and take a look at how this thing actually works from the moment a conversation starts to when a chart is finalized. You know, the beauty of this whole system is really how simple it is. First, the AI just listens in on the natural conversation, kind of like a fly on the wall. Then its powerful engine gets to work, pulling out all the important clinical information and organizing it. The doctor then gives it a quick review, makes any tiny tweaks if needed, and boom, one click and it all syncs up with the main record system. It's just a seamless workflow that cuts out a ton of time and hassle. This really shows you just how much ExamNote AI is doing. It's not just creating the core clinical documentation, the SOAP note, or spitting out the billing codes. That parent-friendly summary, that is an absolute game changer for communication. It's something that's so often completely overlooked in traditional medical software. And this right here, this is the magic of that Parent Bridge feature in action. On the left, you've got the precise medical term the doctor needs for the record, otitis media without effusion. Fine. But on the right is what a parent actually needs to hear, in plain, simple English. The ear infection is clearing up nicely. This brilliant little translation closes a massive communication gap and probably reduces a ton of anxiety. Now, I know what some of you are thinking. Wait, an AI is listening in on a private medical conversation? That sounds a little scary. And you're right to think that. But the people who built ExamNote AI thought about this from day one, and they built the entire system with trust as its absolute foundation.
This lays it all out. But the most important thing to see is right at the top, stateless architecture. It sounds fancy, but it means something really simple, and it's a promise. Your data is processed, but it is never stored or used to train their AI models. Think of it like a conversation that the system perfectly understands but immediately forgets. That, plus military-grade encryption and full compliance with standards like HIPAA, basically creates a fortress of privacy. So, we've talked about the problem, the tech, the security, but what does all this really mean for the actual people in that exam room? Let's talk about the human impact of this technology, because at the end of the day, that is what really truly matters. This is what it is all about. It's about giving pediatricians the freedom to be doctors again, not data entry clerks. It's about letting them lift their heads up from the screen, put down the keyboard, and just connect with their patients on a real human level. We so often think of technology as something that puts distance between us, right? But what if we're wrong about that? What if, when it's designed with real empathy and care, technology can actually bring us closer together? ExamNote AI is just a powerful example of how tech can be used to help restore the human side of medicine, one conversation at a time.